What's cooking, fam? So I'm just laying here in the patient bed in this amazing outfit right here, and yeah, waiting for the doctor to come and get me. So it's around 12 p.m. right now, and I just got this IV catheter with some fluids and, you know, to infuse anesthesia and all that stuff when I'm in the operation. So I'm just waiting here, and I don't know, I'm pretty nervous right now, and also kind of excited because, you know, I really want to get rid of this deviated septum that I have had for like the past few years. And the thing that I'm kind of most nervous about is the fact that I have never been in narcosis or like in general anesthesia before, so I don't know how it feels like to be knocked out. This is going to be pretty interesting because they say it takes only around 10 seconds, so they ask you to count till 10 before you completely pass out and you get knocked out. So let's see how that goes, because I have never been in that situation before, so this feels pretty awkward. And also, this is my life's first operation. I have never been operated or never been through a surgery before. So yeah, I think I'm nervous, but at the same time, I'm pretty sort of excited. And by the way, it's Monday today, and I have my first exam on Friday. So like in 4 days, my first exam on Friday. And also today we got to know that I'm gonna have my oral exam, clinical exam in psychiatry on Monday, like upcoming Monday. So after the surgery, let's see how this entire thing goes and how the exam situation goes, because I'm already not very prepared, you know. So let's see how that goes. So I just spoke to the anesthesiologist, and he briefed me about you know, how the procedure is going to work and how the anesthesia is going to work and what I'm going to be given and all that stuff. And yeah, and now I'm a bit less nervous after speaking to the anesthesiologist, so it should go well, or in most cases it does go well. So it's 12:30 right now, and I have to wait around 1 hour or 1.5 hours more, because the surgeon, who's also my professor, you know, it's all fun and games until the surgeon has been a professor as well. Because he started another surgery right now, so I have to wait till it's my turn. 2 hours later. Alright guys, I woke up from anesthesia a while ago, and I still have a lot of pain in my nose, and I just had some food. But like, it feels like I'm drunk, honestly, because the effect of anesthesia has not still worn off yet. I'm still bleeding a lot from my nose, which I guess is normal, but I need to, you know, change this thing every like 20 minutes because I keep on bleeding. Alright guys, so I'm sitting here right now. I'm waiting for the taxi because the hospital arranged the taxi for me because I'm feeling quite dizzy, and it's really painful, and I'm bleeding quite a lot as well. So the hospital arranged the taxi for me, which I'm waiting for. It will probably arrive in like 5 more minutes. Alright guys, so I just got home like a while ago, and I just changed my bandage as well because I'm obviously constantly bleeding, and it feels really weird because it feels like my nose is super clogged because of the bleeding, obviously. But at the same time, it's also painful, but not really extremely painful, but more like discomfort, because like if I was to explain the pain right now, I think it's more like, it's the exact same feeling when you get punched in the nose real hard. And the reason why it's so freaking uncomfortable is because I'm not able to breathe through my nose, because firstly, my nostrils are filled with like tamponade, and then secondly, I have this bandage around as well, so I can't breathe through my nose. And secondly, even though my nose is clogged, I'm not allowed to blow my nose or clean my nose either for like 2 weeks after this operation. And here's the most annoying part. So I have to sleep with my back upright for like 2 nights in a row. So I can't sleep flat. I have to, you know, sit or lay like this and then sleep for like 2 consecutive nights in order to reduce the bleeding and also the swelling. And this is where the biggest tip that I can give to you guys who are going to get a septoplasty in the near future: please get yourselves a humidifier, because when, like, the day before or the day after, the first day after your surgery is gonna be absolutely horrendous, and that's because you have to breathe completely through your mouth. Your nose is gonna be completely clogged, extremely blocked with all these packings inside. So when you are sleeping, or when you try to sleep at least, your nose is gonna get extremely clogged, yeah, even more clogged, with all the bleeding and all the, you know, boogers, and you will be getting a lot of dryness in your mouth. So your mouth and your lips will be getting dry like every 10 minutes, and then you have to wake up after like every 10 minutes. First of all, take painkillers. Secondly, you have to go maybe change the bandage, and also try and you know, have some water in order to, you know, again moisturize your mouth. And painkillers will be your best friends, because the first night, or the first day actually after the operation, I was taking painkillers after like every 4 to 5 hours, like the maximum dosage and the minimum time interval between these doses. So had it not been for painkillers, I would have been in extreme pain. So last night was a real struggle, and now I'm heading to the hospital once again to get the tampons removed from my nose, because I'm not able to breathe through my nose, as you obviously know by now. Yeah, so I was basically waking up every hour trying to remove the bandage and, you know, put a knee bandage on. I don't know if you guys can understand what I'm saying, because there's a lot of like slime inside my nose. And also, I've got my first exam in 3 days, so I have absolutely no idea how things are gonna go. So I reached the hospital, and by the way, I was not able to film this because taking out the packings was extremely painful. It hurts a lot, guys. I'm trying to exaggerate or scare you people out there, but it really hurt, like for a second, because the problem is, if you do it slow, it's gonna hurt even more. So the entire process of the entire plan were there, so, you know, just remove the packings as fast as possible, and, you know, just jerk them out in order to have the pain for the shortest possible time. So it really hurt, but the pain lasted only for like maybe like 10-15 seconds. But then what happened actually was that blood started oozing out of my nose immediately, like the moment he took out those packings, or the doctor, when he took out those packings. And then I had to, you know, hold a bandage all over my nose and, you know, try and stop the bleeding, which is completely normal. It happens with everybody. Now, even though it was painful, the best part after removing these packings was that it was an instant relief. Like 60% of my pain and discomfort was already gone the moment he took out those nasal tampons. Alright guys, so it's day 4 post surgery, and I'm still trying to get as much rest as possible. So basically all I have in my nose right now are the splints, like the stents, which will be removed next Thursday. So tomorrow I have my first exam. It's Friday tomorrow, and I have my first exam, which is going to be a home exam, so I think I'll tackle that. But then on Monday I have my first clinical exam, so I have to practically be there at the hospital, and yeah, and I'll get a patient, so that will be the exam. So but the thing is, I'm not too worried about my exam right now. I'm trying to not really think about it that much. But anyway, the septoplasty is that I'm right now it's not really painful anymore, but it's more of this discomfort, because you have these, you know, blood clots inside your nostrils, and then you have a lot of, you know, boogers as well, and you can't blow your nose. That's the entire point, because if you do that, then you might get out a lot, then you might initiate a bleeding. So you can't really blow your nose or clean your nose. All you have to do is use saline spray and to rinse and clean your nose. That's what I've been trying to do, but still it's extremely uncomfortable. Even though I can now breathe through my nose, it still doesn't feel that good. When it comes to sleep, I have actually slept pretty alright the past couple of nights. As I already mentioned, the first night was absolutely horrible. That's like one of the worst nights in my life. But the last night and the night before that was pretty good, because I got the tampons removed from my nose, so I could finally breathe through my nose. Now the next few days were not really that bad, because I was able to finally breathe through my nose, I think around like 20-25%, if I was to, you know, quantify that in percentage. I was still breathing through my mouth like 75% of the time, but I was able to breathe a little bit through my nose, which again really helps, because when your nose is clogged and you have just had a surgery, anything will help, you know, to stop that mouth from getting super dry all the time. I was sleeping alright, but I was basically dreaming about the splint removal day every single night, because yeah, these 10 days were like the longest days in my life. And finally the golden day arrived where I finally got my splints removed, and that was like the best feeling ever. So on day 10 I went to the hospital and got my splints removed, and here's the footage, by the way. Now, even though this may sound extremely, or this may look extremely painful, it wasn't really that bad at all. But like, you know, removing the tampons or removing the packings was much worse than having these splints removed.
Ska jag hålla kameran för det?
Du kommer med den selfie-slangen. Så. Ska vi se. Mot nå. Först den. Så kan man få ett sug.
Ja, när man håller den. Ska du hålla kameran?
And man, oh man, the moment the doctor took out these splints, that was like the best moment of my life. Boom, period. Because, you know, I haven't breathed like that for like since like forever, you know. I can't even remember the last time I was breathing so well through my nose. So yeah, it was an instant relief, and I was really happy because these 10 days were like the longest 10 days of my life, and I was really happy that I actually did it, you know. I haven't really regretted since having this surgery. So if you are going to have this surgery done, then please make sure that you get yourself like a air humidifier, firstly. Secondly, drink plenty of water. It may sound really cliche, but trust me, it really helps to stay hydrated. Third of all, painkillers are going to be your best friends. And lastly, please make sure that you know, really think it out, because these 10 days are not going to be easy. I promise you that. It's going to be hard, but it will be worth it in most cases. My doctor said, I think that in 75 or 70% of the cases, you don't really see, or the patient does not really experience any betterment or any results, but mostly it goes really well, and people do not regret having this surgery done. And as you already know, I had this surgery done like 3 days prior to my 4th year medical school finals. So I took 2 of my exams, one written and one oral, you know, with these nasal splints inside my nose. And the exam vlogs are going to be out very soon, so stay tuned for that. And if you want to watch more of my vlogs, then here is a custom playlist made for you guys. Make sure you check them out, and yeah, if you haven't subscribed, bang that subscribe button right now before you leave, and I'll see you guys on the other side. Take care, peace.